Good morning. Welcome to the collaboration meeting of Sattvic Club for Healthy Living and Enunciators Toastmaster Club. So I'm the Toastmaster Amarnath, your Sergeant at Arms for today's meeting. So at Sattvic Toastmasters, we strive to inspire personal and professional growth, all while embracing a holistic approach to living. So let us take a moment to remind ourselves of the mission that guides us. The mission of our Toastmasters Club is to provide a supportive and positive learning experience in which members are empowered to develop communication and leadership skills, result in greater self-confidence and personal growth. To ensure that our speech meeting runs smooth seamlessly and is enjoyable for everyone, please keep the following ground rules in our meeting. Speakers are requested to employ causing we make any reference to sensitive topics such as politics, sex, and religion during the meeting. Please turn on your camera and ensure your microphone is muted when you are not speaking. Kindly rename yourself with role prefix to your name. And may I request all the guests, put guests in front of your name. Our club Sattvic Toastmasters is for healthy living, is focused on wellness and healthy living. And we take any information which is shared here with thoughtful consideration. Please remember that any or all the information shared in this meeting is for general knowledge and educational purpose only. So it is not professional medical advice. If you are considering any actions based on what's shared here, we encourage you to consult a qualified medical professional. Your health decisions are your responsibility. So with this, I officially open the meeting and I'll invite our presiding officer, Toastmaster Adi. Brief intro of Adi. So she recently completed her BBA and going to pursue her MSc in Technical Entrepreneurship and Innovation from June at NTU Singapore. Currently, she is preparing for GMAT exam and focusing on improving her skills and herself to be better version of it. Put hands together for welcome Toastmaster Adi.
Yes. Thank you, Toastmaster Amar, for the wonderful introduction. Good morning, good afternoon, and good evening to all my fellow Toastmasters and dear guests from whichever part of the world you're joining from. A very warm welcome. Another exciting meeting at Sattvic Toastmasters, and as the name suggests, it is all about healthy lifestyle at the same time improving your communication skills. Skills that will benefit you a lot in your personal and professional life. Our motto is not just about health, but communication too. This month, our club is observing Health Awareness Month, a time dedicated to reminding ourselves of the importance of taking care of our physical, mental, and emotional well being. In the midst of our busy lives, we often overlook the simple habits that contribute to a healthier lifestyle, like staying active, eating mindfully, managing stress, and getting enough rest. Through this month's theme, we aim to inspire each other to make small but meaningful changes that can have a big impact on our overall health. After all, a healthy body and a clear mind are essential not only for personal growth but also for becoming better communicators and leaders. Let's use this opportunity to share knowledge, encourage one another, and take one step closer to a healthier version of ourselves. And today is an extra special as we are collaborating with Enunciators Toastmasters Club. Thank you so much for collaborating with us. I'm hoping you'll have a wonderful time with us. Now, I'd like to welcome Toastmaster Priya Rathore, a VP Education of Enunciators Club. She's a seasoned training and HR consultant based in Mumbai, specializing in communication skills, soft skills, and behavioral skills training. She's also an NLP practitioner, a storyteller, and a positive psychology coach. Her passion for public speaking dates back to her school and college days, where she actively participated in elocution competitions. A devoted nature and animal lover, Priya believes in contributing meaningfully to environmental and animal welfare causes. Beyond her professional pursuits, she is also a trained Bharatanatyam dancer, a hobby and passion she continues to nurture with enthusiasm. Now, let's all welcome Toastmaster Priya.
Thank you, everybody, and a very, very warm welcome to this meeting. One of its kind, this meeting is a collaboration in Toastmasters, rightly given the name a joint meeting. Now, let me tell you, though these two clubs are separate, both of them have a separate objective. The objective of Sattvic Toastmasters Club is about health orientation, as the name suggests, Sattvic. So it's a really good angle to bring into life. I think everyone should care about. And another essential component to all of us is our communication. And our communication, if it is done with clarity, everyone gets compelled towards it. So keeping that in mind, we have decided to enunciate. We are a part of District 98, which is in the region Mumbai, some parts of Gujarat, and obviously some parts of Rajasthan. As you know, the Toastmasters is completely divided geographically also. So both our clubs are from different districts. And I think coming together is a wonderful thing for all of us. We have separate orientations merging together. So in this one-of-a-kind meeting, I welcome everybody here with Adi, who is with Sattvic. In fact, I had approached them for this joint meeting. We are really happy to be part of this. Now, taking this meeting forward, we have definitely someone who's going to be the star and going to be the face of this meeting throughout. Before we go to him, I'd like to see if we have some guests, and I think we have quite a few guests here. One request, everybody, if you all can be on your video on mode, so we'll be able to add a face to your beautiful names. So, yeah, we could do that. And we have Ashish with us, who is a guest here, but actually he's a very new Toastmaster. It is his first meeting as a member, in Enunciators Toastmasters Club. Hello, Ashish. And how does it feel being transitioning from a guest to a member?
Hi, this is my first time ever speaking in front of a group of people, actually. And I hope to speak well and redeem myself from the last meeting. Yes.
Oh.
Thank you.
Thank you very much. One of its kind, Toastmasters is a platform that gives you a ready-made audience at any given point in time. You want to speak? You're looking for people who can listen to you? Please join a Toastmasters club. And closer to your home, wherever you can find, if it's an online club, being at home, you can travel geographies. Geography is not a barrier. Okay, with that, let me call upon Manoj, who is also a regular member, I see. Hello, Manoj.
Hi, everybody. Nice to be here and learn something and go back happy. Thank you.
Thank you. Yes, that is surely the objective. We also have Margaret, who is actually a member. Hi, Margaret.
Hi everyone. Good morning. Today is our Palm Sunday, so I'm coming from church, right to join this session.
So glad you made it on time. Thank you very much. We also have Srinivas, who's our guest. Srinivas, hello.
Hi.
Hi. We would like to know from you, how did you get to know about Toastmasters and who inspired you to come for this meeting?
So there was a club called the Young Orators Club in Secunderabad. It started in 1965, I think, probably even before that. And it was doing it was the premier speaking club in Hyderabad for a very, very long time. So I was a member of that, and later I heard about Toastmasters, and I joined them a couple of years ago. I was there with them for a year, and I've been on a break for a little over a year now. So I'm used to public speaking. So yeah.
All right, great. So you already have some experience of Toastmasters. Yeah. We're really glad to have you here. Yes, with that we have another guest, Vani Agarwal. Hi, Vani.
Hi.
Hi, Vani, if you could tell us Where did you get our coordinates of our meeting?
Actually, my dad used to be is a part of Toastmasters. So I used to listen to him speaking and attending the meetings. So I used to be very fascinated by that. That's why I decided to attend as well.
Great. It's really nice when parents who are already Toastmasters are encouraging their kids to do so too. Thank you. Glad to have you here. Then we have Divya Pillai. Hi, Divya. Okay, Divya seems to be away from her laptop. We'll go to another guest in the meanwhile. We have Kendall with us. Kendall Kato. Have I pronounced your name correctly?
Am I on?
Yeah, Divya, I'll just come back to you. Hi, Kendall.
Yes, hi, good day. I'm a member of your global, so that's where I got the information from.
Okay, great. Thank you. We are very glad to have you here. Yes, Divya, hi. I think we've just gotten introduced, right?
So one of my friends.
Yes,
no.
please go ahead.
So one of my friends, she was in Toastmasters last year, and I heard very good reviews about it. So I thought maybe could I try like for a few sessions as a guest and let me decide.
All right. Thank you very much to be here, and thank you everybody. And we also see Ritesh Gupta, Ganesh Rawat, and Ranjeev Singh, who've joined us for the meeting. Okay. So definitely Toastmasters is a platform where people build two skills for sure. One is competence in communication. The second is competence in leadership. When we get into our XCOM roles, the executive committee roles, there's so much that we learn on managing people and managing tasks, managing our roles also when we become a role player. So there, I would say that with so many modules and so many in pathways, so many projects that we can have a propensity of building 300 plus competencies only by virtue of Toastmasters. That is the power of this platform. Online and offline, doesn't matter. When you're talking, you're on to the fore. That is all matters. Okay. Now, keeping in view of this meeting, we have someone who is the driver, the key driver of this show. Now, a little bit about him, who joined Toastmasters in April 2023. That means right after the pandemic. And he joined Sattvic Toastmasters Club while it was chartered. Professionally, he's a founder and a CEO of Customs Broker, having IATA experience of 20 years, and especially into logistic field. From New Delhi, he hails from New Delhi, and has helped more than 5,000 plus entrepreneurs to scale up their businesses, especially in profitability and reducing the costs and time management. So he's also been an author of a book written on manifestations, visualization. So yes, he has, I would say, worldwide connects. We are really glad to have with us the face of today's meeting. As a Toastmaster of the day, Toastmaster JK. Please give him a huge round of applause and let's have him onto the fore. Toastmaster JK, over to you.
Thank you, Toastmaster Priya, and everyone, and for wonderful introduction. So, good morning, fellow Toastmaster and cherished guests. We often say Toastmaster is a platform where communication meets leadership. But today, we are about to witness what happens when excellence meets apathy, when brilliance is matched by a heart of service. Before inviting our keynote speaker, for which I understand you are keen to learn from her, I introduce today's meeting tag team who help in running a smooth meeting. So the tag team, I will invite Toastmaster Dheeraj Singh as GE to introduce the tag team of today.
Thank you, Toastmaster JK Arora. Thank you, Enunciator and Sattvic Toastmaster Club for giving me this opportunity. The role of General Evaluator is to evaluate the overall meeting and give its feedback report at the end of the meeting. To assist me, I have my team, which constitutes of tag team, which means timer, a counter, grammarian. Along with, we have a listener who will raise listening question. We'll check your listening capabilities at the end of the meeting. So please attentively listen to every speaker who is coming on the spotlight. And now I will request all my role players to please come on the spotlight one by one and brief the audience about their role. We will start with first with the timer. So we have a timer, Toastmaster Abhiram. Toastmaster Abhiram, please come on the spotlight and brief the audience about your role.
Am I audible?
Yes, you are
Greetings,
audible.
Greetings, fellow Toastmasters and guests. I'm Toastmaster Abram, playing the role of timer for today's meeting. And my role is to help to ensure all the speakers allotted to the time limits. And for the keynote speaker, the time limit is 20 minutes. At 20 minutes, I'll show red card. Sorry. I'll show green card.
We can't see you.
At 23
Or the
minutes,
card.
I'll show yellow. And for 25 minutes, I'll show red card. And my first is prepare speech segment. And for prepare speech segment, the time limit is 5 to 7 minutes. For 5 minutes, I'll show green card. And for 6 minutes, I'll show yellow card. And 7 minutes, I'll show red card. And 30 seconds of grace period will be given to conclude the speech. And come to the next segment is table topic segment. For the table topic segment, the time limit is 1 to 2 minutes. For 1 minute, I'll show green card. And 1 minute 30 seconds, I'll show yellow. And 2 minutes, I'll show red card. And 30 seconds of grace period to conclude the table topic. And next segment is evaluation segment. For evaluation segment, the time limit is 2 to 3 minutes. For 2 minutes, I'll show green. 2 minutes 30 seconds, I'll show yellow. And 3 minutes, I'll show red. And after table topic segment, we have another which is table topic evaluation. And for the evaluation segment, we have time limit of 4 to 5 minutes. For 4 minutes, I'll show green card. And 4 minutes 30 seconds yellow card. And 5 minutes, I'll show red card. And 30 seconds of grace period to conclude the evaluation. And with this, I hand over the stage to General Evaluator. Thank you.
Thank you, Toastmaster Abhiram, for briefing us about the timing rule. Toastmasters meeting is known for energy and enthusiasm. And one way of encouraging and appreciating the role player is to applause when that person comes on the spotlight. So I request all my audience to please show the raise of hand via video or through the symbols available on the Zoom link to encourage our role players. Now I request our counter, Toastmaster Nitin, to please come on the stage and brief the audience about the role of our counter.
Thank you, General Evaluator. Greetings, fellow Toastmasters and my dear guests. I'm Toastmaster Nitin, playing the Akanksha role for today's meeting. I'm making note of Akanksha, filler words, repeated words, and pauses. Akanksha like so, and so on. Repeated words and filler words. Filler words like so and but so on. For pauses, long pause and short pause. Short pause is considered for more than 3 seconds. Long pause is considered for more than 5 seconds. Use less accounts and make your speech effective. I will be back with my report when General Evaluator calls me back. Over to you, General Evaluator.
Thank you, Toastmaster Nitin. Now I request our grammarian, Toastmaster Priya, who is wearing double hat today. She is also the presiding officer. Along with that, she is grammarian. So with a huge round of applause, let us invite and spotlight Toastmaster Priya. Over to you.
Thank you. Can the Zoom master please spotlight me? The role of a grammarian is that what we can do in order to contribute to somebody's grammar usage. So as a grammarian, I will be doing two things. One is making a note of all the good usages of grammar. Second is making a note of all the not so good usages of grammar. And towards the end, when I'm called upon by the general evaluator, we will have like a very quick, small grammar session like Mrs. Braganza. I'm just kidding. So we're going to look at what the not so good usages of grammar are and how can we revise them, refine them, and correct them. Apart from that, as a grammarian, my role is to give everybody the word of the day. Now, the word of the day is given for everyone to incorporate the new word into their daily vocabulary, thereby upgrading their language skills. So today's word is a very interesting word. It's called proclivity. Proclivity means when you like something, you're liking towards something. You say, I have a proclivity towards this. Let me give you an example. Sheila has a proclivity towards dark chocolates. That means Sheila likes dark chocolates. Or the whole world seems to have more proclivity towards preserving forests. Proclivity. I shall type that in the chat box and also be sending reminders to everybody to use this word. I encourage all the people who come onto the fore to try and use proclivity in one way or the other to your speeches. And for everyone else, the moment you find someone saying this word proclivity, please give a thumbs up like this or a virtual thumbs up on your screen. Thank you, and over to the general evaluator, Toastmaster Dheeraj.
Thank you, Toastmaster Priya, for briefing us about the grammarian role and introducing the word of the day. All are requested to use the word of the day. And Toastmaster, to become a good speaker, you need to be first a good listener. And Toastmaster is a platform where you can learn to become a good listener. And that's why I have a proclivity towards Toastmasters meeting and I attend it regularly. With this, I will invite next role player, Toastmaster Rehan, to come on stage to be on spotlight and introduce about its role. Over to you, Toastmaster Rehan. Please spotlight Toastmaster Rehan. Yeah, over to you.
A large part of communication is always about listening. When you communicate, speak and listen both. We are, however, only taught to speak in schools, colleges, and even at home. Rarely we are taught to listen. Our focus is always on speaking. Being a good listener needs motivation as it allows us to take, understand, and others person's expression of thought. There are various levels of listening too. Toastmasters International encourages this through the role of listeners. As listeners, we may want to encourage ourselves constantly to listen attentively. My role as a listener allows me to keep a tab on all the speeches and communication by our speakers and take excerpts out of them. Please listen attentively and intently as towards the end of the meeting, when called upon by the general evaluator, I shall come up with a quiz and encourage participants based on your listening skills. Thank you, and over to you, general evaluator.
Thank you, Toastmaster Rehan. With this, now I hand over the stage to the lead role, to the face of today's meeting, Toastmaster of the day, Toastmaster JK Arora. Over to you.
Thank you, Toastmaster Dheeraj, and for introducing your tag team. So now I like to introduce, I know you have been eagerly waiting, but let's keep the excitement. and appreciate the energy in this room, because trust me, it is about to get even better. So have you ever heard the saying, a smile is the prettiest thing you can wear? Well, today we are not just going to talk about smiles. We are going to learn how they are crafted, empowered, and used to change lives, one confident grin at a time. So it is my absolute honor to introduce someone who doesn't just create a smile, she sculpts them with science, skill, and soul. Our keynote speaker today is Dr. Swati Bajaj, a name synonym with excellence in dentistry and inspiration in leadership. A gold medalist, MDS prosthodontist with a super specialization in oral implantology from Germany. She's not just qualified, she's super qualified. She's a certified smile designer. Yes, that's an actual thing. And within 15 years of experience, she has been transforming not just teeth, but lives. Dr. Swati is a proud founder of Tarash Dental, a premier clinic in New Delhi, where she combines cutting-edge dental care with a touch of artistry. But beyond the clinic, she wears multiple crowns. In 2020, she was named the top 10 women dentists in India by Women Entrepreneur magazine. In 21, she bagged the Young Dental Achiever Award from the Indian Health Professional Awards. I know her personally from last 2 years as BNI member, where she is very active. Due to her parents' motivation, she is active philanthropist, devoting her 10% income and time to NGO Sada Foundation with vision of empowering village women and child education. She is also the recipient of the Sashak Philanthropy Award, recognizing her efforts in empowering and educating women in society. Now I know what you are thinking. Dentists are the ones who cause us pain, not this one. Dr. Swati is here to bring it a smile, inspiration, and probably worthy antidotes that will help us rethink how we view our well-being, our confidence, and yes, even our smiles. Her journey is one of precision, passion, and purpose. And I'm sure her words today will leave us all not just wiser, but also grinding ear to ear and lot of inspiration. So without further ado, please join me in giving a loud, toothy Toastmaster applause for a keynote speaker, Dr. Swati Bajaj. So you have a 20-minute speech and 10 minutes for question and answer. Over to Dr. Swati Bajaj.
Thank you so much, JK sir. That was such a lovely introduction, and I am highly obliged today to be amongst you people, you lovely people from across the globe, and having such a lovely morning today. And I hope to have your attention today for the day and for the time which I've been allotted. And I hope to leave you with some good tips and tricks to maintain your smile. And as can you get me the word of the day again? It was
Proclivity.
Proclivity. Yeah, that's what as we all have a little proclivity, a good deal of proclivity towards good smiles. So let's begin with that note. Do I share my screen with you?
Sure, we'll give you the phone. Yeah, Dr.
So,
Swati, you can go ahead.
Yes.
Yep.
So I hope everybody can see that. Today, I've been invited here from for a speech and for a talk on teeth and aging. And this topic is really close to my heart because I'm a prosthodontist and I construct smiles. So I really love to enlighten you with the fact that what you can do to keep your youthful smile for a longer period of time. And for that, I will be sharing few simple tricks and tips and tricks which you can just inculcate in your daily habits and keep a youthful smile for a longer time. So when we talk about aging, all of us imagine our so we always imagine ourselves aging somewhat like this, enjoying our old age with our partner. But unfortunately, what we usually see at our clinics are people like this. And most of them like this because they are not able to enjoy the foods they eat and are always stressed about losing their teeth, about having difficulty in chewing. But with a little care in your daily practices, you can be this, enjoying every food and enjoying a good smile with your friends till a longer time. So without delaying it, let's first understand what exactly oral health is. So when we talk about oral health, when my patients come to me, most of the time they relate oral health only with teeth. And they ask me, doc, whether my teeth are okay, please check all my teeth. But nobody talks about the other parts. And today I will give you that secret that it's not only about teeth. It's about your teeth, gums, and bone. All these three components constitute a good oral health. So don't just focus on your teeth. Gums is a very equally important part of your oral mouth, and it needs to be healthy in order to maintain a harmony and a good oral health. Now, it's important to know why we are focusing so much on oral health in a month which is on the awareness of health. So oral health is not just about your mouth. We usually say that your mouth is the mirror to your body. If you have a good mouth, you usually have a healthy body. And I will tell you how. You know, a lot of times patients come to me, and by just looking at their mouth, I can tell them that this person is under stress because that the person is grinding his teeth too much. And that shows that he's mentally stressed. A lot of time people come to me and have such profusely bleeding gums, which shows that probably they are a diabetic, and that's why, and they are not taking care of it. Sometimes we happen to diagnose these situations just by seeing their mouth. A lot of times vitamin deficiency patients are diagnosed at dental clinics. You would be surprised to know that a lot of pregnancy complications are now related to the dental health. Like, we all know that there are hormonal changes during the pregnancy times, and if it is along with a dental infection, the person might end up delivering a preterm baby, and that's a very serious complication which is happening these days. So we usually tell our patients to keep a check on their dental health, because not only your heart, mind, your pregnancy, your diabetes, also your lung diseases, a lot related to your mouth. The mouth is a structure which is full of bacteria. And when you inhale these bacteria inside. And inhaling bad bacteria can lead you to lung disease. So having a good mouth is equal to having a good body, and vice versa. So beware that the bacteria which is in your mouth are good bacteria, because these bacteria are drawn towards the bloodstream and they go to the blood and then go to different organs in your body and can cause a disease in your body which you would not even know. So oral health is definitely a very, very important topic and needs a lot of attention to maintain a good body. Now, let's see how we can have this oral health, how the habits which we need to learn. I think most of the habits we already know. For example, brushing daily, I think a lot of us know, but we don't do that. We just brush once in the morning and expect the nature to take care of the rest, but it doesn't happen like that. So please do not skip brushing at night, because it's a very, very important thing, because we keep on munching something or the other at night. And since most of us are Indians here, so I think having a sweet tooth is a inborn thing amongst us. And eating something which is sugary and sleeping without brushing at night means that you are creating a party for the bacteria inside your mouth, and then those bacteria gives you good amounts of cavities in your mouth. So club eating healthy fruits, vegetables, along with brushing 2 times a day, and along with flossing it. Flossing, I don't know how many of you know. Can I see a raise of hands? How many are aware of flossing? What dental flossing is? I don't see a lot of raise of hands. Probably it's yeah, somebody there. Yeah, so he's been flossing. Oh, a lot of people. Oh, that's good. That makes my job easier. So I know that you have my attention. So yes, so the flossing is cleaning in between the teeth. And once you are cleaning in between the teeth, you are keeping your entire mouth clean. You're also cleaning the gums in a way. Can you see the video of flossing going on, and the floss is going and cleaning in between the gums? So this is a very, very non-negotiably important part of your oral hygiene, which we are not taught at a early age, and should be taught, because it helps you clean your teeth in between, which is the most common site for having cavities. And moreover, if you are not flossing, you are not cleaning 30% of your teeth, which again is a very bad area to have, because you are having a lot of growth in this gum area, and that is causing you a lot of disease, a lot of cavities. Okay. Apart from these 3, yes, you have to visit your dentist every 6 months for a regular dentist. People who are joining us from out of India, they would know that yes, this is a norm in countries outside India, that they have to have a regular 6-monthly dental visit, so as we catch upon your dental diseases at a very early stage and take care of it. So early cavities can be filled very easily. A regular cleaning is a very healthy habit. So if you visit your dentist every 6 monthly, you actually prevent a lot of diseases which might be coming up. You can get rid of that scare, which you actually, a lot of people are scared to come to dentist because they are scared of that pain. But let me tell you that pain is just a result of your neglect. So if you stop neglecting your little needs, I think we will all have a very healthy mouth and a very bright smile for a longer time. So now to sum the oral health tips up, we need to brush properly. Also, along with brushing 2 times a day, the brushing technique is a very important thing, and most of us are doing it wrong. So like I would actually like to demonstrate a proper brushing technique. So this, if your teeth is, and most of us are brushing in this manner, which is like horizontal manner. Please stop doing that. You need to brush in the vertical manner or in the circular manner, but not in this manner, because this is really harmful for your teeth. And brushing each and every corner of your teeth is very important. Whether it is down, it's up, in this area, lot of these things need to be taken care of. Okay. So the proper brushing technique. Flossing is as essential as brushing and non-negotiable. Please don't sleep without brushing your teeth. Drink a lot of water, eat fruits and vegetables, and consult your dentist every 6 months. So now that we know that, yes, what are the measures to keep your teeth healthy? What if I have a problem? What are the signs which I should be aware of? So the signs that show that your teeth are aging are following. Okay, so let's discuss them in a little detail. So if you are suffering from tooth pain and sensitivity, that means you are having some cavities in your tooth, or maybe some broken tooth or enamel chip off or loss of enamel layer. I hope everyone is aware of the layer of enamel. Are we good there? You know what enamel is? Yeah. Okay. So losing the layer of enamel is like losing the outer shell of the coconut. So coconut is protected by that hard outer shell. And similarly, your tooth is protected by that hard outer enamel layer. So once you lose that, it enters the softer part and the problem begins. So if you are having cavities, please don't ignore it. Go to your dentist. They will do a minor filling and you would be good and you would be free from the cavities. Okay. Now, broken tooth, these days we have a beautiful option which is called inlays and onlays, which are basically the fillings which are made up of the material with which the crowns or the caps are made of. And they are very sturdy and can be done in merely 2 appointments and can save you from the dreadful RCTs and crowns with which you are scared of. So those are again a very good option which you can opt for. Losing layer of enamel is a very sad part because your teeth start looking yellowish and nobody wants a yellow smile because we are living in an era of selfies and social media, and smile is a very important component. Like JK sir just mentioned that a smile is the prettiest thing you can wear. So having a beautiful smile is definitely adding to your confidence and personality improvement. So yes. So another sign which is common and which is usually missed is increased brittleness or fracture of your teeth enamel. We all have a habit that we brush in the morning and we check our teeth in the mirror, right? Most of us, I think, do that and we check it like kahin kuch black to nahi hai, isn't something, no cavity is starting. But what we miss is the neck of the teeth. And that is the most important area. And one fine day, what happens is you start having a little sensitivity to your teeth. And what we do for rescuing it, we brush very hard, like this, to help us prevent that sensitivity. But that is seriously not the solution. You are actually causing more damage to your teeth. And this part of your tooth, which is the neck of your tooth, is the part where your enamel is the thinnest and is the most sensitive. So if you are brushing horizontally, so you are actually inviting trouble to yourself because you are damaging the enamel from this area. You are causing irritation to the gums and the gums would shrink, and you would invite the areas to be open to bacteria, which would further cause cavities in this region. And once this area is disrupted, whenever you eat anything hard, it just cuts, fractures. So it's a very sensitive area and should be very, very is taken care of. So what are the remedies you should do for it? First of all, use a soft toothbrush. I think now we are all on the same page of using a softer toothbrush. But yes, for the people who are young, and they should use a medium soft toothbrush, not a ultra soft one, because that doesn't clean. But yes, a softer toothbrush is always a better option. Follow a proper brushing technique, just like how I demonstrated. It should never be horizontal. It should only be vertical or circular. And restore these cavities as early as possible with the help of fillings. Your dentist can do just fillings to help you restore these and prevent you from the after effect of breaking your tooth. So do that. Another common problem which people come to us is bleeding gums. A very common, I think a lot of people would be experiencing already bleeding gums while brushing. And the common reason for bleeding gums is usually a deposit layer which is there in your gums, between your gums and teeth. And this is bad for both your gums and teeth. And whenever there is something wrong with both gums and teeth, the bone automatically goes for a toss. So as we learned before that the three of them have to be in harmony to maintain your oral health. So bleeding gums is a thing which can be cured the most easily. You can just go to your dentist and get a professional cleaning done. Sometimes people also ask me, doesn't this get cleaned while we are brushing? That's a very important question. And yes, I would answer that. It is basically you have a plaque buildup in 24 hours time, which can be cleaned very efficiently with brushing. But some of the remnants of that plaque remain because we happen to not know the proper brushing technique, or maybe we are not brushing at night, and that deposit, that plaque, gets little hard and becomes into tartar in a day, in 2 to 3 days time. And once the tartar becomes a little more hard and is not removed, it becomes a calculus. Calculus is something where a stony hard layer which is present between your gums and bone, and it has a lot of bacteria in it, and that bacteria is causing cavities in your teeth and damage to your gums. The gums keep on shrinking, and we see that our teeth having that yellowish part exposed, which is again not a good idea. And we can just avoid it by getting it professionally cleaned in a 6 months time. Okay. A lot of people also have weak gums, which causes bleeding gums. And for that, they can go for using, there are solutions available in the market. They can use gum paints, which are available in the market. Those gum paints, you can just take it on your finger and rub it on your gums in a circular motion. And that really helps. Another important thing which you can do is use a water flosser. This is a water flosser, a picture I put in the slide. It generally has a jet of water, just stream of water, which clears anything which is stuck between your teeth. Another common problem which is causing bleeding gums is the food lodgement. A lot of people must be experiencing, I think, they have particular areas in your teeth where the food goes and gets stuck. And once that food is stuck, you keep on having a bad breath in your mouth and bleeding gums in problem. So there's a simple solution, that you start using flossing, start doing flossing, or start using this water flosser before you sleep. So you just have to use this, fill this with little lukewarm water and use this jet stream to clean between your teeth. So if there is anything stuck, it would get cleaned and you will not have that dirty smell of your mouth, and plus you will feel more fresh and your gums would thank you so much. Okay. So these are the things which you need to check. Then you would be surprised to know that difficulty in chewing food was a thing in past, which was more common amongst people who were 50 plus. But nowadays, we have so many youngsters, like people in their 30s or 40s come to us who have grinded their teeth because of stress, and they cannot stop that problem, and because of which the muscles here, they have become so thick and they have to work so much more and to help you chew better. And for this also, this one-off dentition is not such a good idea, because like I told you before, that the enamel layer is the hardest layer. Once you happen to lose that enamel layer, your tooth is all soft. It is like a coconut. And once the level reaches the dentine, which is a softer layer, it goes on wearing off at a very fast pace. This can also be because you have teeth which are not positioned correctly or malaligned. So if you have malaligned teeth, a lot of times what happens is parents don't pay attention to a child's teeth, and the child grows up with teeth which is not positioned nicely. And then we think when we grow up that now I cannot do anything about it. But nowadays it is not a scene. We can definitely correct our alignment, and we can definitely get braces or aligners at any age because of the highly advanced technology which we have nowadays, and that allows you to align your teeth, especially for the people who have a deep bite. This is a very common problem and should definitely pay attention to correcting the positioning of their. Another problem which causes the difficulty in chewing is cavities in their teeth, which can be simply restored with the help of fillings. Yeah. But lost vertical height of your teeth is definitely a problem. And I'll just show you a few cases to keep you interested. This was a patient of mine who came to me with this kind of smile, and she was not happy at all with her teeth. And she was a patient who was nearly 70 years old. And she just wanted that you correct my front teeth because I'm not happy with the smile. When we actually looked into the problem, she had lost entire of her vertical height and enamel layer. And we did a full mouth rehabilitation. And I'm so glad that now she thanks me every time she meets me that, I cannot be happier and my smile is so good again. So smile is not only just for eating, or healthy teeth is not just for eating. Yes, definitely it's a very big part of your life, but that also adds to that psychological confidence that you can walk around with a good smile. And I think it's for everyone, whether you are young or old. Everybody loves a beautiful smile. This is again for a businessman who was really accomplished, but he was still always sad because he would never smile. And his children brought him to me, and he was so unhappy with the smile. He showed me his teeth and said, "Doctor, how can you expect me smiling with these teeth?" And this is an example of loss of your enamel from the front surfaces. I think you must have seen some people like this who have teeth like this. And there is a very simple solution, which is laminates or veneers, which we were discussing. I would show you what exactly these are. These are thin shells, just like the nail of your hand. And we can paste it over the person's teeth and improve the smile like so much, so much. Another person who was there, and she had this was a young bride who was about to get married, and she was not really happy with the smile because of, you can see how her teeth were. And she said, "I have the most beautiful lehenga, most beautiful jewelry, but my photographs would not come nice because I would not smile with these teeth." So this is what laminates or veneers can do to your smile too, and can give you the confidence to smile. You can see the change in her smile, and it's just beautiful to change people's smile and see them change their entire lives after that. Another patient, and this is how basically a veneer is. It is this thin, which is just pasted on your tooth, and you can transform your smile a lot. This is again because of the alignment issues she was having, constantly chipped off teeth. And once the alignment was corrected and laminates were done, she was unstoppable. So definitely having a good set of teeth is God's blessing. But if you don't have to worry. You have the options available so much. Another sign of aging teeth is missing teeth. That is a sign of your sheer negligence, that you have been avoiding all the signs and symptoms which your body has been giving, your mouth has been giving. And signs like you were having sensitivity to cold first, you ignored it, then it was sensitivity to hot, then you ignored it again, but it turned into sensitivity to sweet. Then you stopped eating sweet at all. And then one fine day, that tooth finally gave up and broke. And this is how you have missing teeth. So please stop ignoring the signs of your body and come to the dentist at right time, so that you can get things done in time, and you can have your own natural teeth lasting for a longer time, because your natural teeth are an asset and nothing matches the strength of your own natural teeth. Yes, we have the options of replacing teeth very close to the natural, but trust me, your natural teeth strength and chewing ability is still unmatchable. And one important thing, why we should replace the missing tooth, because a lot of time I've seen people come to me and they say, "I have 32 teeth. If one is missing, so what? I have other 31 and I would chew with that." This is what happens when we don't replace our missing tooth. This missing tooth is there. The side teeth, they start sliding. The upper tooth would slide. Then the other teeth will become loose. Your bone morphology becomes loose. You lose even these two teeth. Then it's like a vicious cycle. So please don't take a missing tooth lightly. It's a very important thing, and you must restore it at right time to avoid inviting troubles. Actually, there's a very important story of a patient who came to me 6 months back, and it was a very learning experience for me also, because the patient came and he told me a story that he had started having twitching in right side of his body, and his muscles started contracting whenever he used to eat food. Whenever he used to eat food, he used to go like this. So he visited his physiotherapist. He thought probably there is some muscle which is getting twitched. The physiotherapist gave him therapies for quite a long time, but could not treat it. Then the therapist sent him to the nerve doctor, and the nerve doctor again gave him a lot of medicines, but nothing happened. So he was referred to medicine doctor. Medicine doctor gave him BP medicines, nothing worked out. Medicine doctor referred him to psychologist saying you have anxiety. Psychologist did a lot of therapies but could not find out anything. He sent him to psychiatrist, and he was just after the doctors, and somebody suggested him to go to a dentist. And when he went to a dentist, he found out that he had got his 2 teeth extracted 1 year back and never replaced them. And that is why his skull was losing balance and was searching for balance every time he was trying to eat. So the importance of missing teeth is a great deal, and we should not take it lightly and should not actually land up in that position. But if you have already landed up, so please don't take it lightly. These are a few missing teeth replacement options. You can always go for a fixed tooth replacement. Nowadays, we have a beautiful technology, which is dental implants, which can be placed just where your tooth root was. And once it is binded with the bone, we can place a crown over it without disturbing any of your other tooth. It can be also done for people who are missing all their teeth, and they can enjoy their rest of their life with fixed teeth and can enjoy whatever they want to eat. And there is no eating restrictions with this technology. Dental bridge, again, was a replacement option, which is very prevalent, in which we take support of your 2 adjacent tooth to replace the missing tooth. And this removable prosthesis, dentures, I think all of us have seen our grandparents queuing with them, is kind of a little old school thought nowadays, and is a little less prevalent because nobody likes removable things in their mouth. But yes, this is again a treatment option which is available. This is just a case to show you how much difference your smile gets with replacement of missing teeth. So this is how it was. You can see the change of personality just by replacing 2 front teeth in the person. So now to sum it up, the signs when you need to visit a dentist is whenever you are having a recurrent bad breath, a persistent jaw pain or swelling in your mouth, difficulty to chew food, swollen or receding gums. So let's see how attentive you are. So can you all tell me what you are finding missing in this picture? Just a show of hand.
1 teeth.
1 tooth? Yes. I need more answers. Toastmasters, come on, show me some energy this Sunday morning.
The missing tooth.
Missing tooth?
Not aligned tooth.
Not aligned.
Eyebrow
also.
And missing eyebrow.
Missing eyebrow.
Yeah.
Somebody noticed. Yes. But most of you, since you all answered, apart from a person who is actually attentive, a missing tooth, even though he's missing an eyebrow, the first thing which comes in your mind is a missing tooth. So that's how important your smile is, and should not take it lightly at all. I hope I've value added to you. And to conclude, I would just say that a healthy mouth is a source of a healthy body. So be thorough with your oral hygiene practices. And I hope you would inculcate few of the habits which I have added. Thank you so much for having me today. And let's hit it. JK sir, I hope I'm in time.
You're on mute, JKG.
Thank you, Dr. Swati Bajaj. So you have explained in a very humorous way and storytelling of your experiences, which is very good for and so you have highlighted dental health is piece of cake. If we build a proclivity for daily flossing and regular checkup, this can make a world of difference, not just to our smile, but our overall health. So now we open the floor for question, whether it is about oral health, building a purpose-driven practice, or working in philanthropy. Dr. Swati is here to share for 10 minutes. Please go ahead.
So, Dr. Swati, I'm Vrunda here, and thank you so much for this wonderful presentation. You seem to be a born Toastmaster, so that was excellent. And you also use the word of the day. I'll try to use the idiom of the day and ask, if you have to eat a piece of cake, do we have to brush right away? That's one question that I have. And I have few serious questions too that I'll ask after that.
So answering your first question, actually, please don't brush immediately after eating. That's a 100% no-no, because once you are eating something, you are generating acidic environment in your mouth. And the moment you brush immediately after eating, you actually tend to create more damage rather than doing good to your mouth. So you should always brush before and or half an hour after eating something. So I know it was a humorous question, but giving you a serious answer back. Yes, Brenda.
Yeah.
Again,
Thank you.
Here's some serious questions from you.
Yeah, so just two questions. One is about the water floss. Like, can we buy any water floss, or is there something that we need to look into a water floss? And my second question is related to, again, dental hygiene, which is about stains. Like, we use turmeric in our food, and we also use tea, coffee, something like Indian culture. So, are there any escapes to this for the stains?
It's a very valid question and a very good question which you asked me. Yes, you can actually water flosser. Firstly, coming to your first question, you should buy a water flosser by Ora Cura. It's a very good water flosser brand which should be considered while buying. And otherwise, you have a lot of options available. Dr. Trust is there. Then Oral-B water flossers are there these days. And there's one company, Dentident, which is also doing a very good work with water flossers. And yes, what you should see is at least 3 modes of water flossers should be present while you are buying it. And the tank should be at least 150 to 200 ml. And the modes which should be present is basically one where the water goes in directly, one where it is pulsating, coming like in pulses, and secondly, where you can reduce the stream of water. So that is how you should select your water flossers. Second question, that definitely is a very good question again, that how should we avoid stains in the mouth? For that, first answer would be, please don't brush too hard to avoid those stains. What you need to do is brush with a soft toothbrush, but brush regularly, like brush morning and evening both. And yes, since we are in a society where haldi and turmeric is a major ingredient and tea, coffee is a mode with which we connect with people. So yes, it is difficult, but yes, it is maintainable. And brushing and flossing would really help you there. And if you are using a water flosser along with it, it's a piece of cake. All right.
Thank you so much.
Yeah, hi, Swati ma'am. Myself, Shahid. Yeah, thanks for enlightening us with your session on the dental health. So, as just a follow-up question on the thing which you just informed to Vrunda on cleaning the teeth after having the cake, right? So, but after having the food, we will rinse with some water and we will do them some finger. Is it allowed?
Yes,
Immediately.
you must rinse your teeth with water after you eat anything, because once you rinse it out, you remove any stuck foods with the help of water. And later, like, if you are brushing 2 times a day, that is more than enough. If you are having any braces or anything, then the brushing is more stringent. And then you are advised to brush after every meal. But after every meal means after 30 minutes of eating, because 30 minutes while we are eating something, our mouth releases acid so that it can be digested. And once you brush in that acidic environment, you are actually causing that acid to spread all over your teeth and creating more acidic environment, which is again a area where you are actually inducing cavities. So yes, brush, but after 30 minutes, and rinsing is definitely advisable. Even after tea, coffee, if you rinse your mouth, you actually help to prevent a lot of stains there and then. Because it doesn't stay. Also, one more thing, the more moist you keep your mouth, like the more saliva you have or more water you drink, the lesser amount of stains or deposits you have in your mouth. So yes, definitely would advise you to go for rinsing every time you eat something.
Okay, thank you. Thank you so much, ma'am. And I have a question related to the wisdom teeth. So the teeth which comes at the end, right? So it is causing some problem to your jaws or to the skin at the end. So when to remove it, and can you put some light on it?
Yes, definitely. It's a good question. Actually, I forgot to incorporate the wisdom tooth dilemma in my presentation, and good that you brought it up, Shahid. Very good question. So wisdom tooth is usually a tooth which comes in the last of our teeth on jaws, and it is usually comes somewhere from age of 17 and can come even till the age of 35. So once it comes, it usually we have nowadays have small jaws, and there's hardly any space for the wisdom tooth to erupt in the straight manner. I would say the people who have straightly erupted wisdom teeth are lucky people, because they are very few, and most of us have tilted molars which are coming in, and basically the wisdom molar, if it is tilted, you must just get it removed and get rid of it, because wisdom tooth which is coming in a tilted manner would create pressure on your front molar, and sometimes if it erupts a little and still tilted, it would will invite a lot of food lodgement, which is a common complaint, and you would have a swollen gums around it, a constant pain which is there, and you would keep on taking painkillers or antibiotics to avoid the pain, but it would in turn damage your front molar, and which would lead to RCT of the front molar plus extraction of the wisdom tooth, which makes no sense. Rather, if you get it extracted in time, you would save your front molar from getting damaged. So right time is whenever you are experiencing any kind of pain of the wisdom tooth, please visit a dentist. If it is coming tilted, please get it removed.
Okay, there one more question, ma'am. So related to the gaps in the teeth. So how do we look after those gaps in the lower jaws? Gaps in the teeth.
Gaps as in the back teeth or in the front teeth?
In the front teeth.
In the front teeth. If you have front gaps in between your front teeth, you can actually go for aligner treatment to reduce those gaps and to align your teeth better. Or else you can also go for the veneers treatment. And if you don't want to get any kind of treatment done, because gaps usually invite more of the deposits in general, so you should get a regular cleaning done for your mouth, both gaps, and if you have unevenly placed teeth, those people tend to have more deposits to themselves. So yes, it is advised to maintain it with a little more vigilance.
Okay, thank
You
you.
can
Thank you so
also
much.
get it built up with filling materials. Like there is direct composite veneers, which you can get it done. So the ceramic veneers, which I was showing, were a more permanent option, but you can get it built with filling material, but it is a little more temporary.
Okay. Thank you, ma'am. My proclivity towards your session made clarified many doubts. Thank you so much.
Thank you so much.
So, any more questions?
Yes, Dr. Swati, Ashish here.
Yes, please.
Ma'am, I have actually replaced my front tooth with a crown a few years back. And over the years, I've been noticing that it has gotten a little bit darker actually towards the upper part. So is there any need to worry about that, ma'am?
See, that might be because the crown which you have been given was having a metal base inside. Nowadays, we actually go for metal-free crowns more often. And the reason is this only because this was a constant problem which was faced in past, that if you have a crown with a metal base, the area near your gums start looking darker over the time. Is that
Yes,
that I'm
yes.
heading rightly? Yeah. So that is because maybe you're having a metal base in your crown. So you can always get it replaced with a more current trend, which is a metal-free crown or a zirconia crown. Even we have the options of Emax crowns, which is completely matching with your tooth. But yes, if it is causing a darker gums, I think replacing it is a better option because the change in color of your gums would not get normal after that.
Okay.
Okay.
And ma'am, is there any other option beside crown for me?
Besides crown, actually your tooth must already be prepared for the crown. Actually, for giving a crown, we remove a lot of the part of your natural tooth. And once you have already got the crown done, then replacing it is the only option. If you would not have got the crown done, nowadays we are using very conservative options like veneers. But since you already have that, you only have the option of replacing it with another one.
Okay. Thank you.
One more small question, again a general one, which is I have heard that whenever there is gap between your teeth or as you age, your teeth start shifting, or rather it shifts for everybody throughout your life. Is that true?
Right. Yeah, that's absolutely true. As we age, our teeth starts coming forward. So if people have gaps, they start having gaps, more visible gaps, or increasing those gaps. So that's a common phenomena for everybody. Yeah.
Okay. So do we have to work on the gaps, or or at what point do we have to work on the gaps? Is it just cosmetic, or it has scientific relevance?
It has a very huge scientific relevance. Like as we age, what happens is our teeth, like I was mentioning also in my presentation, that our teeth gets worn off, like the back teeth gets worn off. So your muscles become more active and they try to work more to close your teeth. When they do that, the forces on your front teeth are increased. And because there is more forces on your front teeth, they start moving forward to avoid that forces. And that is why if you prevent the wearing away of your back teeth, this problem would in the very first place not arise. So the chewing teeth, which are the back teeth or molars, those need to be preserved in order to preserve your front teeth. So firstly that, but if it is already happening, then you can use the help of the alignment or aligners to correct it, and then firstly take care of the backside teeth so that you don't over grinding it. The vertical height which you have is very important, because I would like to highlight on this point that a lot of times we see people who suddenly have this wrinkles over here and have very thick cheeks, and they talk but their teeth are not visible. Those are the people who must actually do something about their worn away teeth, because it would actually cause a lot of problems, and these musculatures become very tight and thick and would in turn again cause the problems, increase the problems there. Yes.
Okay, thank you. I didn't even think about this one.
Yeah, we happen to do that now.
I have a question, if you permit.
Yes, ma'am. Yes, sir. Please go ahead.
Mostly children take toothpaste inside while brushing. Is there any side effect of that?
Actually, it's a common phenomenon, and that's why when you make your children brush, you should use a special toothpaste which does not have fluoride in that. Actually, fluoride is a very important component in development of your teeth. And if the child is constantly swallowing your toothpaste, the one which you are using, which has a lot of fluoride in it, the child is ingesting a lot of fluoride, and that would cause a bad effect on development of his permanent tooth. So yes, you should use a fluoride-free toothpaste for children who are at least till 5 years of age. And after that, 5 ppm of fluoride is what is allowed for them. But please don't allow them to eat the toothpaste which you are using.
Can you name the toothpaste which
There are many children-based toothpaste. Pediflor is one of them. Then there is Cheerio Gel. These are amongst the good toothpastes for kids. So you can use them. There is also Colgate Kids, which is also reasonably good toothpaste. So any of that, depending upon the age range. Like if the child is less than 5, please use a toothpaste which does not have any fluoride, 0 fluoride level. And if the child is 5 to 12 years of age, use a toothpaste which is having a fluoride content of 5 ppm. If the child grows above 12 or is in the mixed dentition phase where the child is losing his milk teeth and the new teeth are coming up. So in that phase, there is a very good toothpaste. Its name is Enafix that you can use that prevents cavities in children. Okay. And once the child crosses the age of 14, then you can start the adult.
Thank you. Thank you so much.
Dr. Swati, during your presentation, you mentioned in one of your slides some terms like inlay, outlay, or something like this. Is it something like a crown, or is it different?
Actually, it's different. And nowadays, we have a lot of research and a lot of modern treatment options available, and it is one of them. So what we have these days is if you have a part of your broken tooth, initially what we used to do was to do RCT for that and then place the entire crown. Now we don't believe in that. What we do is we just measure that part and take a measurement of that and get a filling which is built in the material of crown from the lab. And the lab gives us that particular area, and we do not touch rest of your tooth to preserve your own natural enamel and bond it there. So it becomes like a natural tooth part for you. So it's called inlay or onlay, and it works wonderfully well. Like if you have a big cavity in which the cavity is not in which the filling is not staying, we do inlays or onlays for them, and it gives a great result. Like it prevents you from the root canals and from the going for complete crowns, and your natural teeth lasts longer, which is again a miracle.
Okay, thank you.
Okay. I'm really loving the energy because I think a lot of active members, and I was really worried that people would sleep through my presentation, but I love to hear so many questions from you people.
We would sleep after the meeting.
Okay, any more questions, please? Okay, thank you, Dr. Swati, for clearing many common myths about dental health. And also, I'd like to inform that Dr. Swati has accepted our request to give free consultation online for 1 week to all of us Toastmaster. So connect and follow in social media. Her team is very active. So thank you again, Dr. Swati, for sharing incredible journey, insights, and energy today. And I think we can all agree we have walked away little wiser and definitely smiler. So let's give her a huge round of applause. Yeah.
Thank you so much for this opportunity, sir. I really appreciate. It's a group of very enthusiastic people, and I've had such a lovely Sunday morning today. Being amongst you people. Thank you.
Now I request our
JK sir, we have
presiding officer. Yeah,
we
Miss
have the
Adi
certificate
to
presentation.
felicitate Dr. Swati Bajaj.
Thank you so much.
Yeah,
Thank
with
you so
certificate
much.
of appreciation. Yeah.
Thank you so much, Dr. Swati.
Thank you, ma'am.
Thank you so much for joining us and enlightening us with so much of information. I think most of us did not hear most of the things that you have spoken today, and we'll try to keep that in mind, and we'll, as JK sir said, we'll walk away with little wiser today. Thank you so much. I hope you will come back to us. You'll do few more presentations for us. Thank you so much for joining us. Please accept the appreciation certificate.
Thank you so much.
Thank you once again. And now let's continue with our next exciting segment of our meeting.
And yeah, sorry for interfering, Toastmaster JK sir. I would like to remind everyone that today we have a very, very exciting Toastmaster table topic session. So I hope every one of you stays back. Thank you.
Thank you. So our next session is, I'll request Toastmaster Vrinda as evaluator to is our speaker. Please introduce the speaker and their speech, please. Toastmaster Brinda.
Yes, sure. So I have Toastmaster Rajesh, who's doing his project one speech, level one, project four, second speech, and the speech is in the humorous pathway. So I am going to be evaluating Toastmaster Rajesh on his uh, pa- the second pathway or the second speech. The title of his speech is Encounter with a Scam Caller. Encounter with a Scam Caller, Toastmaster Rajesh, over to you, or to Toastmaster JK Arora, however it works.
Yeah, over to Toastmaster Rajesh for your first speech. Please go ahead.
Thank you, Toastmaster JK. Am I audible?
Yes, yes.
It was a Sunday, a lazy Sunday afternoon, and I was having my green tea along with makhana, given my proclivity to good health. When suddenly I got a call. The caller ID says it's an unknown number. Now, picking up a call like that will actually be like playing Russian roulette. You know, does anyone know Russian roulette? It's a matter of life and death. I anyway decided to take a call, chance, and I picked it. Hello. Yes, hello. Is that Mr. Rajesh? Yes, Rajesh here. Mr. Rajesh, this is Officer Thomas from Mumbai Police Cyber Cell Division. Now, the moment I heard this, I knew most likely this is a scam call, given the large amount of awareness campaigns that's going on for scam call. But rather than put the phone down, I decided to test it out. Jai Hind, Officer Thomas. It's a Sunday afternoon. For police, there is no holiday. We found out that there are large number of anomalies with your Aadhaar number. Is that? Can you share some details? We found out on investigation that your Aadhaar number is linked to 17 different bank accounts which are into money laundering. You could be arrested anytime. So when I heard this, I felt like laughing, because you talk about 17 different bank accounts. I don't have enough money for one bank account. And when you say about money laundering, the only kind of laundering I know is laundry for clothes. But anyway, I decided to play around. Is that so? So, what do I do? Very simple. You just need to pay 50,000 rupees to government bank account. Then we will avoid this. 50,000. Okay, if I pay it by credit card, it will be a piece of cake. Now, I could sense excitement. He has made an offer and I seem to have accepted it. Okay, good. You please should give me your credit card details. Here it is. 1234 5678 9101. Now give the 3-digit PIN. Okay, please write down. It is 420 420. There was a moment of silence. Mr. Rajesh, you are being simply funny. This is a very serious matter. I humbly state I am being very serious. I am not funny. Now, he knew I was pulling his leg, but he is still persistent. I am sending an OTP. You please share it with me. Okay, please note down. It is CHEATER. There was a long silence. And I could hear him saying a cuss word in a regional language, which I understood. Now, I told him, Thomas, what is your batch number? He was shocked. Now, I use this opportunity to say some dialogues because I have a proclivity towards movies. Thomas, I am not flower, I am fire. What do you mean? तुम जिस स्कूल से आते हो वहां के हेडमास्टर हम हैं. You know whom you are talking to. You have actually been so foolish, you are calling a real policeman from a cyber cell in Mumbai police. I was engaging in a conversation with you for so long so that I could track your location. Now the real police will be there anytime and you will be behind bars, see you in jail. There was a long pause and he put the phone down. So I had a good entertaining session that day. But I'm also sadly aware that a lot of people have lost a lot of savings because of these scam callers. Any one of you have got scam calls? Has anyone lost money? I'm sure most of you would have. Okay, there are people who have lost money as well. Absolutely. You know, they are the scum of the earth. You know, we should not have any kind of sympathy towards them. So what I would suggest is, rather than when you get a scam call like this, rather than put the phone down, see if you can make their life miserable, you know, frustrate them, make it difficult for them so that they are not encouraged to call you again. Of course, you can always put it down whenever you want. So how do you do that? So let me suggest 3 ways that you can do. 1, how many of you have given galis in your life? Abusive words, expletives. If you are somebody like me who has never given it, it is never too late to start. Take down a paper and pen, write down all the galis that you have heard in your life, be it Hindi, Punjabi, or any regional language. And when you get a call from a person like Thomas, shower it on him. Of course, he will get angry, he will come back with his own galis and you can get into a slanging match. But anyway, you will waste his time. Lesson number 2. How many of you, or idea number 2, how many of you have heard this song Natu Natu? I'm sure people from Hyderabad, across India and the world. Okay. Now here, you have to play quiz. You know how? Here is Thomas. I want 50,000 rupees. You say, yes, I am willing to pay 50,000 rupees. You have to answer my question. Okay, fine, tell me. In the song Natu Natu, tell me how many times the word Natu is repeated. Natu, 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 Natu. The guy will go mad. You will have fun. Lesson number 3 or idea number 3. Ask for money from him. So here is Thomas again asking for money. Give me 50,000 rupees. You say, I am willing to give you anything, but I don't have cash in my bank. Can I request you to a loan of 50,000 rupees? You are a scammer. You are going to jail anyway. What will you do with that money? You give it to me. I will pay you back with interest after 10 or 20 years when you come back. He will be scratching his head. I am coming to take money from him and he is taking from me. So these are ways by which you can confuse these people and have some fun. Thank you.
Thank you, Toastmaster Rajesh. It's really wonderful, and we are facing this challenge daily. And thank you. Over to Toastmaster Brinda. Yeah, please.
Thank you, Toastmaster Rajesh. Your speech was so funny. I was literally laughing out loud. And I should say that your speech was a total scam. By scam, I mean SCAM, scam. S is for storytelling. It was laced with so much of humor and so many anecdotes, lovely language that you used. You used Bollywood, you used all kinds of drama, laughter. It wasn't bucket loads. The other thing that I liked was your C, which was the content. You had hooked us right from the beginning with your title, actually, when you said that it's an encounter with a scam caller. And then you took us through this big, lovely storytelling. And I was enjoying your speech. Yours is a long speech. I don't know, probably you're experienced Toastmaster. I'm not sure, I don't know you so well, but your delivery was flawless. Your speech, your content, everything was well organized. A is for articulation. You used lovely language. You added humor. The three-letter code 420. Then the Natu 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 was hilarious again. So many things that your engaging humor pathway is something that's justified. And if I have to be honest, I haven't heard such a humorous speech so far where I've been laughing out loud. So wonderfully done. And the last M from the SCAM acronym is for the memorable message. You have given us some hilarious advices like keep some cuss words handy so that you can use it on somebody else. You talked about Natu 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 and ask them, like, ask for money and ask him a quiz question. So these are like so many things that I might keep the recording and go through your speech again and again. It's enjoyable. Few things that I would love for you to use so that you can take your extraordinary speech to even further extraordinary levels is probably when you were using this and this for doing the characterization. You could actually do some drama, add some drama to it, use a prop like a phone and use the actual phone like this. That could help, and you could probably stage yourself from this side to this side. I think these are only small tweaks that could enhance your speech. You're already fabulous. You're probably contest ready. With that said, I would look forward for you to keep visiting, and I would always enjoy your speech. Good luck and keep shining. Thank you.
Thank you. Over to our next exciting table topic. So over to Toastmaster Adi for a table topic session.
Yes. Okay, now we're coming to fun and interesting session of Toastmasters table topics. Table topics is where everyone gets opportunity to speak spontaneously, and it is a very crucial trait everyone should learn so that they will prosper in their personal and professional life. But today we are giving a little tweak to our regular table topics. Today I'm going to play a track, a sound, and I want you to speak either about the first thing.
Adi, sorry to interject. So there are many new people joined. So you just give a brief about what is the table topic is so that they will also understand and participate in the session.
Yes. So table topics is a session where I will generally give a topic. Usually they will give a topic and you need to speak about it for 1 to 2 minutes. At 1 minute, green card will be raised, and 1 minute 30 seconds yellow card will be raised. At 2 minutes red card will be raised. You need to speak at least 1 minute to get qualified for the poll, and there will be 30-second grace period. So, but for today, we're going to just give a twist to it. So I'm going to just put on a track, an audio, and you have to hear it. And you have to either speak about the first thing that comes to your mind, or you can speak about any memory related to that sound. Okay, I hope every one of you are ready. So just let me start with, and yeah, one more thing to give you guys. So from now onwards, we're going to have a table topics evaluation as well. So you will be evaluated for your table topics. And today we have DTM Noor to evaluate your table topics. Thank you so much, DTM Noor. And now without further delay, let's start with table topics. Are there any volunteers? Yeah, we have one first timer. I'll try to give something easy. Okay.
looking for a comedy.
Just a minute. Now that is your track, Vani. So I hope you understood. And now you can speak for at least 1 minute, but maximum 2.5 minutes.
Means a lot. So, firstly, listening to the track reminded me of Rain, the storm. And as a young teen, I love that weather. So, I remember that one day it was a stormy weather, and me being very fascinated by that weather, I went for cycling. I kept my phone and everything at home, and I just ran. I ran out of the house. I took my cycle. I was cycling around the society. Usually when we stand in the rain, the voice, the storm, that does fascinate us. Well, but yeah, while I was cycling, the noise, the voice that I heard, I was lost in that. I was lost in that moment. I didn't care that I'll fall sick or whatever came after that. I was just enjoying my time at that time. And to be honest, I feel that the rainy weather or the stormy weather brings along a lot of stories, like the smell of the sand, the smell of the soil. The smell of the soil, and a lot of moments we've spent with friends as well. We've gone to school in rain. We used to run out no matter how the teachers would stop us during the PT lecture. So those were the memories which came when I listened to that audio. And surely, a specific personally, I have a proclivity towards a rainy season, towards stormy weather. So I truly love it. Thank you.
That's a very great attempt, Vani. I think you are a born Toastmaster. I think definitely from Toastmaster Pratik, you have learned a lot. Congratulations, you did a great job. Now we have Toastmaster Bala.
Yes, Toastmaster Adi, I'm here. One second.
Yes. I hope you're ready for your sound.
Yes, I'm ready. I hope I'm audible and visible to everyone.
Yes.
I want that Harley Davidson. That Harley Davidson is what I want because I don't feel it's a piece of cake to buy a Harley Davidson in life. Ladies and gentlemen, that was me almost 20 years ago, where I wanted a bike. And I would say it was no proclivity to have a bike at that time because I did not have any money. My father had to buy me a bike. But that sound of the Harley Davidson is what I really wanted, and I wanted it so badly. And I thought, I'll get it. After a few days, or after a few years, I understood. Why should I have a Harley Davidson when I have a Bajaj Pulsar to go around the town? Why not enjoy it? There are times where you feel you want a Ferrari in your life. But what will a Ferrari do when you're stuck in traffic? Think about it. Same thing. That Harley Davidson did not happen in my life, and I am not really curious why it did not happen. But Is there something in your life that you want to achieve that's beyond your limits? Think again. Why don't you just go for the normal thing and achieve it? I did that. Would you do that? Back to you, Tabletop Master.
Thank you, Toastmaster Bala, for doing a great attempt at the speech. Now we have Toastmaster Sanjeev Kumar Singh. Are you ready for your track?
Yes, Toastmaster Adi.
Okay.
Baba.
I hope you understood the track.
So this is a sound. This is a sound for parent who waiting for his child to come first and say Papa. So this is sound when I hear first time in 2002 when my cute baby speak first word Papa. The same sound still I'm hearing from her mouth. Now she's 18 years old and she's doing her study. So this is a fantastic sound. Everyone want to listen it. And this is the way universe move. The civilization grow and we become parent. So becoming a parent and listening to this sound is everyone busy there. Just understand the person who is childless. Can he hear it? No. Therefore, every person wishes that to hear this sound of the first word come from his child mouth. I hope that everyone like to listen it. Thank you. Over to Toastmaster Adi.
Thank you, Toastmaster Sanjeev, for sharing your fond memory, I would say. Thank you so much for sharing. And next we have guest Srinivas. Are you ready for your track?
Yep.
Okay. I hope your track is, you understood your track?
Yeah. So
Okay.
I remember, I'm reminded of there's an English song, I think, Who Let the Dogs Out? Right? I mean, so it's only in India that when you're on the street, you're afraid of street dogs, apparently, because I've not been out much. And they can be quite scary, especially because I used to work a few years ago in a BPO, and I'd be coming back home at 1:30, 2 o'clock in the night. And a lot of time, I mean, almost always, I mean, probably I'd be coming back on a bike, and these dogs on the road are quite scary. I mean, like, apparently they also led to a death of a person who was trying to avoid them in Hyderabad. And every now and I mean, every few years you hear an instance of something like that happening, and municipal corporation taking action. But I think I must admit, though, that I am not finding anywhere as many street dogs on the road nowadays as I used to back then, which is much like the pothole situation in Hyderabad, right? I remember talking to a friend just early in the morning today, and he was saying potholes in Bangalore are a problem. I said, what potholes? I mean, like, seriously, I mean, I thought India has moved from potholes, right? So, staying in Hyderabad, I seriously believe India has moved from potholes, but he says potholes are a problem in Bangalore. I wonder, seriously, because Bangalore is a very rich city. I'm sure it can take care of its potholes, certainly, if not widen the roads. Widening the roads is a totally different ballgame altogether, but potholes, I'm sure Bangalore has the money to take care of it, and I'll have to see whether it is what he says it is. But like, yeah, there are much fewer dogs scaring you. I'm not out much in the nights nowadays, but clearly, there are hardly any dogs scaring you on the roads anymore. And what is even more wonderful, much like the dog situation, there are very few potholes, and that's a wonderful feeling to have, when you know you can trust your roads.
Yes. Thank you so much, Toastmaster guest Srinivas, for sharing your speech with us. Now we have Ashish, guest Ashish. Are you ready to hear your track? Okay. Okay. I hope you understood your track. That's a notification sound.
Yes, I understood. Yes. It is very rare for me to hear a notification sound because all my notifications are off and my phone is mostly on silent. So whenever I hear this sound, I am reminded to once again put my phone on DND mode and continue to live my peaceful life. And it just so happens that first time when I first bought my phone, that I didn't really think much about doing right things with my phone. Like I used to watch YouTube all day and subscribe to random channels which I found funny. And so the notifications kept piling up in my phone. And so one day when I decided to just quit it all and delete my YouTube channel, and also I was reminded to take more time off the screen, and I think life is better that way. All of you should try that. Thank you.
Thank you, guest Ashish, for giving the table topic speech. And now we have Shravan Kumar. Are you ready for your track?
Yes, I'm ready.
Okay.
System. I hope this is an music. I mean, the music for one of these songs, but I don't remember.
No. Just a minute. That's an ad. Just a minute. You can hear it now. Yes.
Yes, I could hear.
Yeah. Yes.
All right. So this is very crucial. Without this, it is not, you can't hear by others, but this is very much needed to run our life until between this life and death, we call it, right? So this sound supposed to be heard by each one of us. And of course, you can also sometime make sure that you can control it with the help of the meditations also. So this is actually a heartbeat. So without the heartbeat, nobody can live. I think not to think. This is an evident that we each one of us should take care of this heartbeat, and this happens as soon as we um, we born to this world and until our life ends. So to take care of this, we need to ensure that we eat healthy, and also at the same time ensure that we don't put much pressure on that. When you put much pressure, then the other impact on our health, it impacts the other health conditions. So which is also indirectly it affects our heartbeats. So keep the rhythm always as as in rhythm, so which will help for our longer life. So without have eat healthy food and have a healthy heart. Thank you. Over to you, Toastmasters.
Thank you, Toastmaster Shravana Kumar, for giving your speech. It was wonderful. Now that with keeping the time in mind, I think we need to conclude table topics now. Zoomaster, can you please launch the poll? After poll is done, we'll go for table topics evaluation.
Poll has launched. It is on your screen. All are go ahead and vote. Cast your votes. So far, we receive only 50%. I would encourage you to everyone participate in this. Last few seconds to end the poll. Right, 5, 4, 3, 2, 1. We're ending the poll now. Thank you, everyone.
Thank you, Toastmaster Amar. Now, can I request DTM Noor to give evaluation for the table topics?
Thank you, presiding officer, fellow Toastmasters and dear guests. A very good morning to you all. Now, we heard wonderful sounds and even wonderful stories. Today, I'm going to help you improve your delivery in table topics. Now, the first speaker was Vani, and she got the sound of thunder. Now, Vani, first thing I liked about your speech was you had that vivid imagery in your mind already, right? You said, I love that weather. As soon as you heard it, you said, I love that weather. That implies that you're recollecting from your memory. And that's wonderful for table topics. As soon as you hear a topic or a sound, if you could recollect a particular incident from your life, that's a wonderful start for a table topics, right? So, and you told us a story about how you went out cycling in your near your building and you got lost in that moment. It was a rainy weather. You also told us that rainy weather evokes stories, smell of the soil, friends running around in the rain, and the moments of joy. I truly love it, the way you conveyed that message. Yeah. One thing, Vani, is that when you are giving a speech, this can improve your impact of table topics, is to conclude emphatically, right? And I love that moment when I was in the rain, right? A little bit of vocal variety also would help you. Yeah. But you are a very good speaker, Vani. Thank you for sharing your story with us today. Now, second speaker, Bala. Bala got the sound of snoring, but he heard it as Harley Davidson sound. It was a sound of snoring, somebody sleeping and snoring, right? But Bala, whatever you get, you ace the topic somehow. I love that whole disposition of you getting ready for the table topic. You show your body, your gestures are free strokes, and you have that wonderful facial expression. Your vocal variety is amazing. One thing, Bala, just one suggestion for you is that when you're building that story, your rate tends to get a bit slow, right? When you are speaking, your rate of speech tends to get a bit slow, right? If you could just take maybe 10 seconds, right, to just have a overview of a story which you want to say, right? That would keep your pace uh, flowing so that we can flow with your topic. You are a wonderful speaker, Bala. I always take inspiration from you. Thank you for sharing your story today. The third speaker was Sanjeev Kumar. He heard the child's laughter, right? And it was so evident in Sanjeev's face, the kind of memory he was recollecting from 2002 when his daughter first spoke that word, Papa. You know, I'm sure all parents cherish this moment in their hearts. The laughter of the child. It's one of my favorite moments when I heard my son say Papa for the first time. So I still recollect it. So Sanjeev, what I would say is that you spoke from your heart, and that's what is more important in a table topic. When you're speaking, that conveys authenticity, that conveys sincerity, and people are more willing to listen to you. Sanjeev, I'll give you just one advice. Please work on your grammar a little bit. Yeah. You tend to lose certain prepositions, certain conjunctions in between. So I would suggest that you focus on when you're delivering when you're talking in English, try to focus on your grammar a little bit. If you listen to TV and radio in English, you would understand, how you can make things work. Right? Thank you for sharing that wonderful story of your daughter with us. The next speaker was Srinivas. He heard a dog barking furiously. Now, Srinivas, I must admit, you are a wonderful speaker. I, I couldn't believe that you were talking about dogs. You told us about the first thing which came into your mind is who let the dogs out, right? And that got me onto my seat. I was attracted towards your topic. And you spoke about Indian street dogs, and they can be quite scary. You told us about a personal story when you were working at BPO, and you also told about a new snippet that a guy died in Hyderabad dodging a dog. That was wonderful. And what captivated me was you talked about pothole situations and dogs analogy. That was wonderful. You told the pothole disappeared as how the dogs disappeared in Hyderabad. I'm from Hyderabad. I know that dogs have disappeared. They have become more luxurious now. They don't come out. They're eating nice bones, sitting in shades. They don't come out as they used to come out in the 80s and 90s. And you talked about Bangalore, right, and widening of roads and that wonderful feeling when you know that you can trust the road. Srinivas, I think you are a natural speaker, and you can connect things. That's wonderful. You are a perfect example of a awesome table topic speaker. You're in the league with Bala, right? So I think that if you could just conclude effectively, emphatic conclusion, a strong message for us, right? That would be great. Otherwise, I have nothing to say to you. The next speaker was Ashish. He heard a notification sound. Ashish, I really like that connection you made. Notifications, you put in D&D mode, color. You get into Do Not Disturb Me, and I am sure you had that story, your YouTube story of how you pestered with notifications and how you got rid of those notifications. And life is better that way. Now, one single suggestion for you, Ashish, is that uh, tell a story for us. Tell a story of how your life is better without notifications. How yes, your life was miserable with notifications. If you could just give us some examples, then we would all be inclined to believe that we should put our phones on DND mode and life would be a lot better. You would be more convincing that way, right? If you give reasoning, we're all adults, we understand reason, right? Other than that, Ashish, you're a great speaker. Thank you for sharing your story with us. Right. The last speaker is Shravan Kumar. Shravan, you are a national speaker as well. You heard heartbeat, And that facial expression, when you see a person, face is the index of the mind, someone said, right? You had the glowing face, and you stated the most obvious fact that heartbeat is essential for living. You control it with the help of medication, and you emphasize on eating healthy and not putting too much pressure on the heart. Healthy food, healthy heart, great message. But if only if you could share, instead of starting with the most obvious fact, right? Heartbeat is the most essential thing for living. What you could do is you could start with a story. This was a sound I heard for the very first time in such clarity at a hospital. Right? You transport us to a hospital, you tell a story about a hospital, right? So think of a great opening. It's always so that would make your speech very captivating and attention grabbing, right? So with that, my dear friends, general suggestions for all of you to attend or attempt table topics is number one, take 4 or 5 seconds to think about what you're going to speak. Don't immediately start, right? Take time, think about the topic, understand the topic, and then think about one incident from your life, one incident, and then you can start a story, right? Second thing is use vocal variety, like how Bala used, or how Srinivas used, or Shravan Kumar used. Use vocal variety. It's very important to use vocal variety. Change your rate a little bit, increase your sound a little bit, decrease it, and tell that I know that this was the saddest part. And you reduce your voice. That captivates. The whole idea is to captivate the audience's attention. And lastly, conclude with energy. People listen to people who talk with energy, who talk with passion, who talk in with such an emotion that you are forced to listen to them. All great speakers speak with great energy. So try speak with energy. All right. It comes with time, but if you focus on that, you would develop confidence, and also you would be able to captivate a lot of audience. With that, thank you very much for giving me the role of the TTE. I truly appreciate all your speeches. Wonderful. Thank you for sharing with us here today. And I welcome you all for our next meetings. Do come, do share your stories. We really like listening. Back to you, Pio.
Thank you. What a learning. A really heart-to-heart connection. And this session is like a movie. Starting with the sound with Toastmaster Adi, then all participant has too much involved in that and given a sound of a movie. And what I will request GTM Noor, it's he has brought all this to a movie, is a feature of voice modulation, and we learn a lot from him every time. Even a small, like says na, that is small in a movie, small act he does, and that movie become a blockbuster. So today table topic has become a blockbuster. Now coming to our next session. So as time is less, I'm concluding is fast. So I'll request GE to please, Toastmaster Dheeraj, please go ahead. Yes.
Dheeraj, you're muted if you're speaking.
Thank you.
You are muted, I think. You are muted, no voice.
Am I audible now?
Can't hear you.
Yes.
Yeah, please go ahead.
Thank you, Toastmaster of the day. Now I'm spotlighted. So in Sanskrit, there is a saying, Pratham Sukh Nirogi Kaya, which means the first source of happiness is to have a good health. And it's good to see that this Toastmaster Club, Sattvic Toastmaster Club, is incorporating in this meeting health and awareness as its theme. Kudos to you. And in Toastmaster, there is a saying which is feedback is the breakfast of genius, and general evaluator session is all about feedback. So my feedback report will be divided into two segments. First will be the report by my tag team, including the questions from the listener, and then I will give my overall report. due to the interest of time, we have a limited time. So in the interest of time, I request my tag team to please cut short your report and quickly deliver it. So we'll start one by one. First, I request the timer to please come on the stage and give its timing report. Over to you, timer.
Am I audible?
Yes.
Yeah. And Dr. Swati Balaji, which is a keynote speaker, who is a dentist and gave us a lot to chew on. And time management was a piece of cake. And she wrapped up at 29 minutes. And for the first segment, which is prepared segment, Toastmaster Rajesh has spoken for 7 minutes 19 seconds. And table topic segment, speaker one, Swati Agarwal, spoke for 1 minute 20 seconds. And Toastmaster Bala spoke for 2 minutes 19 seconds. And Sanjay Kumar Singh spoke for 1 minute 43 seconds. And Srinivas Bhatt spoke for 2 minutes 11 seconds. And Ashish spoke for 1 minute 28 seconds. And Shravan Kumar spoke for 1 minute 47 seconds. And evaluation segment, Shashi Kumar spoke for 2 minutes 50 seconds. And come to the table topic evaluation, Noor Mohammed spoke for 10 minutes 3 seconds, which exceeds the time limit. And I want to congratulate everyone who qualified for the given timelines. And back to general evaluation.
Thank you, Toastmaster Abhay, for the timing report. Now I request our counter, Toastmaster Nitin, to please come on stage and give his counter report.
Thank you so much, General Evaluator. I'm back with my report. Greetings again, everyone. Starting with Toastmaster Amanna, Toastmaster Adi, Toastmaster JK, Toastmaster Swati Agarwal, and Toastmaster Srinivas. Congratulations to all the members, to all the members who have 0 accounts, 0 repeated words, 0 fillers. Let's have a big round of applause for these people. Thank you so much. Toastmaster Priya, I have 2 accounts. Toastmaster Abhiram, I have 1 account. Toastmaster Rihan, I have two accounts. Toastmaster Vrinda, I have 3+ accounts. Toastmaster Rajesh, I have 1 account. And repeated word like, the word like for 2 times. Toastmaster Bala, I have 2+ account. Toastmaster Sanjeev Kumar, I have one account. Toastmaster Ashish, I have two accounts. Toastmaster Seven Kumar, I have 2 accounts. And the repeated word have for 2 times. Toastmaster Noor Mohammed have 3+ accounts. This is my account report. I hope you make some changes from now onwards. Thank you so much, everyone. Over to you, General.
Thank you, Nitin, for your crisp counter report. Now I request our grammarian, Toastmaster Priya, to please present the grammarian report to the audience. Over to you.
Thank you. Zoom Master, may I request you to kindly spotlight me? Thank you. Okay, I would want to begin with the very good usages of grammar today. Yes, we've had a splendid grammar day. Okay, we had anomalies and advocating vivid imagery. It implies you recollect. And I would say that most of this contribution is by DTM Noor Mohammed. So fantastic job done on that. Rainy weather evokes stories. Conclude empathically. Vocal variety. Captivating. Empathic. Concluding empathically. And redefined. And more, actually. So there are many that I couldn't write very scrupulously. Okay, and coming to the not so good usages of grammar, we had, okay, here I'd like to make a change. Smell of the soil with the first rain is called petrichor. Okay. Becomes a child. So becomes a child will become a child because you're talking about one child, which is third person singular. So singular. Can be heard. So here the pronunciation error here would be can be heard. First, prom, the purst and prom, it gives a per sound to the F, the fur. So always nice to, this is a sound to be made by friction. So you can use first, from. I am reminded to put my phone on silent. Reminded to was repeated twice. Reminded to, the correct preposition for this would be reminded about, or reminded of. Reminded of will be the most appropriate preposition here. We can sometime, we can sometime hear from, so here sometime in the context, it had to be sometimes, not that one. We were born to this world. We were born in this world. Contextual clarity here would be required. Don't put word pressure. Don't put word pressure here again. I would say word pressure of what? So it requires a little bit of, word order arrangement of the sentence. Healthy food. So will be healthy food because F-O-O-D, it is double O, but it is actually a short vowel sound. So it will be food. Okay, food. And if you say, long vowel sound, food. F-O-O-T, again, double O is there. That you will use as a short vowel sound. So foot and food, two differences are there. Thank you so much. And yeah, for the word of the day and the idiom of the day, Dr. Swati used it. Toastmaster Dheeraj used the word of the day. Toastmaster JK used the word of the day quite a few times. Toastmaster Vrinda used the idiom of the day. Toastmaster Shahid used the word of the day. Toastmaster Rajesh used both the word of the day and the idiom. Toastmaster Vani also used it. Toastmaster Bala used the idiom of the day. And if I have just missed out anything, any other people, I'm so sorry, human to err. Thank you, and over to you, General Evaluator.
Thank you, Grammarian Toastmaster Priya, for our brief, and you have paid attention to the minute detail. Kudos to you. Now I request next role player Toastmaster Rehan, who is a listener, to test the listening capabilities of our audience. Please come on stage and test our audience. Over to you, Toastmaster Rehan.
Good afternoon, fellow Toastmasters and dear guests. I'm Toastmaster Rehan, and I had the pleasure of serving as your listener today. My job was simple but fun. Stay sharp, listen closely, and catch the listening. Funny and unique things that were said during the meeting. Now, let's find out just how well you were listening. I have a few quick questions to set your ears. Please feel free to raise your virtual hand, and I would request to avoid chorus answers. Let's keep it fun fair. Ready? Yes, no, maybe. Are you all ready?
Yes.
Who was the first prepared speaker?
Toastmaster Rajesh.
Right answer. So, virtual round of applause for, I don't know who answered, but yeah. What was the word of the day?
Proclivity.
Yeah, right answer. Team Eddie, thank you. That's right answer. Can anyone mention 2 tips for oral health?
Brush twice daily and flossing.
Who brought up the question about recommended toothpaste for children?
Rehan, Toastmaster Rehan.
तुम जिस स्कूल से आते हो वहाँ के headmaster हम हैं. Who used this line during the speech?
Toastmaster Rajesh.
Toastmaster Rajesh.
Yeah, right answer. Which table topic participant mentioned he always keeps his cell phone on silent mode?
Guest Ashish.
Yeah, right answer. Toastmaster Eddie, I think you are the only one who is answering. Everybody was listening, right? Who made the audience laugh today?
Toastmaster Rajesh.
Yeah, right answer. So, only 7 questions were allowed, right?
Yeah,
Over
that's
to
fine.
you.
No,
Yeah,
that's fine.
thank you. Thank you.
That's fine. Yeah.
Thank you, Toastmaster Rehan, for your questions. It was interesting. Yeah, as we have already exceeded the time by 30 minutes, I will keep my report very crisp, and I will start one by one from all the role players. First was Sergeant at Arms. So meeting started on time. Kudos to him. He mentioned about the mission statement of Toastmasters. He mentioned the ground rules to be adhered during the club meeting. Good work. Kudos to you. Only recommendation is that it's your responsibility to spotlight the role player who is coming on the stage, who is speaking. So ensure that you spotlight every time so that the audience get to know who is speaking and whose turn is there. Coming to the presiding officer, both Adi and Priya added energy and enthusiasm in the beginning of the meeting. Kudos to both of them. They highlighted the importance of health and wellness. And yes, guests were introduced and welcomed in the meeting. Good work, both of you. Next was Toastmaster of the Day. He introduced all the role players properly. He maintained a very calm and composed posture during the meeting, which shows he is a matured and veteran Toastmaster. One recommendation for him is that you are the navigator of whole meeting. It's your responsibility that the meeting adheres to the agenda, specifically the timeline mentioned in the agenda. It's your responsibility that no role player exceed the time limit allotted to them. So with this recommendation, you have done a very good job. Kudos to you. Coming to the keynote speaker, there is a saying called smile is a curve which makes everything straight. And if you have a beautiful smile like that of her, then it adds to your personality. So we learned a lot, many things about hygiene, about dental hygiene and overall wellness. Kudos to our keynote speaker. The next was our speaker, Toastmaster Rajesh. He was a good, confident, good stage present. He enacted when he was mentioning about different character. He was having good voice modulation. He added humor. People can remember his speech for a while. And one recommendation for you is that, like, you are already an advanced level speaker. You need to pay attention to your presence in your, whether it is in stage or whether when you are spotlight. So keep your camera, keep your virtual arrangement in a proper manner so that when you come on the stage, you appear as an advanced Toastmaster. Your presence should be prominent enough to get impact on the audience. Table topic session. It was a very innovative way of doing the table topic. Kudos to our presiding officer as well as table topic master, Toastmaster Adi. She was wearing double hat today. It shows her enthusiasm and encouragement. Kudos to her. Only recommendation is that when we give a table topic, we allow the role player, the participant, to interpret it in its own way. Like suppose when you played the song of Heartbeat, the member was perceiving it as a music theme. So you stopped him and you again played it to get the exact note what you wanted to. So in Toastmaster, we allow the participant to flip the topic and choose the topic which they want to say. Otherwise, it was a good table topic session. Coming to the evaluator, so Brinda mentioned all the things, and yes, it was a good evaluation. No recommendation, no suggestion for her. It was already good evaluation. She mentioned the commendations. She mentioned about the recommendation of the speaker. Coming to the table topic evaluation, it was perfect. And after listening to the evaluation by Toastmaster Noor, I wished I should have participated in the table topic to listen to his personalized feedback. Coming to our tag team timer, your timing report was crisp. Only one recommendation that at the end you mentioned that who have qualified and who have not qualified. If all the role players have qualified for the voting, mention all have qualified. It's your responsibility to ensure and mention it to the Zoom master that all are qualified, whether to include them in the polling or not. Grammarian, superb, everything was there and paid attention to the minute details. Again, our counter was good and his report was brief and crisp. Coming to the generalized recommendation, like in Agnel, we ensure that the word of the day and the phrase of day are added in the agenda itself so that the audience have an idea of the word of the day and the phrase of the day. I don't know under whose purview this falls, so I am keeping it as a generalized recommendation. Second was that the keynote speech took a major portion of today's meeting. I think it was almost 1 hour or more than that. So keep some more content of regular Toastmaster meeting, give more attention to the regular Toastmaster meeting because it's a joint meeting. All the role players should get sufficient amount of time. So next time we can cut short the educational session or keynote speaker so that we can give sufficient time to the regular Toastmaster meeting part. One more thing that in the beginning we mentioned, like if anyone uses the word of the day and the phrase of the day, the audience can increase that person by showing thumbs up. So that can be mentioned in the beginning. I don't know under whose purview this will fall. Otherwise, it was a good meeting. I enjoyed it and everything of it is good, especially the part that you are paying focused attention to some specific objective like health and awareness month and some other theme meeting. With this, I enjoyed the meeting. Kudos to all the role players. Over to you, Toastmaster of the day.
Thank you, Toastmaster Dheeraj, for a wonderful GE report and all the tag team. So as we wrap up today insightful session on dental health, I thankful to all and we walk away with new proclivity, not for sweets, but for better oral hygiene and regular dental care. So now I invite Toastmaster Adi to give the presentation. First, there will be a there will be a report. Okay, Toastmaster Adi, please.
Thank you, Toastmaster JK Arora, for doing a wonderful job as Toastmaster of the Day. Thank you so much. Now I request Zoom Master to launch Best Lead Role Player as well as Best Auxiliary Role Player polls.
Sure, I'm launching.
In this time, I think we can ask few guests their experience of attending this meeting. Let me start with Vani. How did you feel about today's meeting?
Honestly, today's meeting was pretty good, and as my first time experience, I really loved it. It gave me new learnings and a great experience.
Thank you. Thank you so much for giving your feedback. I hope you'll come back again and you'll attend so many more meetings. And now we have guest Srinivas. How did you feel about today's meeting?
It was a very well organized meeting. I was surprised, and even the quality of speakers, the evaluations, and all is actually quite good. So in fact, I was surprised how good it was. So I think it was a very good meeting, and good to know a lot of the people in the meeting are from Hyderabad. Just a pity that I have not met so many of them. So yeah, so a very good meeting.
Thank you. Thank you so much for your feedback. Next guest Ashish.
Yes.
May I know how?
Yes,
Yeah.
the part I like the most about this meeting was how forgiving everyone is of someone who doesn't speak so well, like myself. And it allows me to speak more freely and express my thought exactly as I think. Thank you.
Thank you for giving your feedback, but for the information, you are a very good speaker that I want to assure you of. So if you speak more, you'll become the best speaker.
Okay, thank you very much. Actually, I don't have a proclivity to speak more in front of people. I am usually a silent listener in most of the situations.
I think then Toastmasters is the apt place for you to speak more.
Yes,
I
I
hope
will
you'll
try
join
that.
many more meetings. Yeah, thank you.
Thank you.
Now, Zoom Master, I think you can end the poll.
So, sorry to interject, Adi. Like, we have a tiebreaker between all three in lead role players. So I would encourage who can tiebreak the results. I receive only 9 votes. If anyone can left, you can go ahead and vote.
The co-host can do the tie breaking because they're not voting, isn't it?
All right.
All right. We have Margaret also in the house. Margaret, what is your experience today?
Hi everybody. Today's experience being a joint session, it was wonderful, and especially the special section regarding the oral health and hygiene and how it affects our general health. It was very informative and very good for if we follow all this class. If we follow her instructions, it will help us to lead a healthy, wealthy life. Definitely, it was a very wonderful session today. Thank you so much.
Thank you, Margaret.
Thank you so much, Margaret. Yeah. Now we have Adil Sheikh. Would you like to give your feedback?
Hello, good afternoon to everyone here. It was a really wonderful experience attending this Toastmasters meeting today, and I had previously attended various Toastmasters meeting in my past years, and this was one of the best so far meetings I have attended in virtual mode.
Your voice is not audible. Yeah.
Oh, sorry. So, cutting it short, the experience was pretty much really good, and I enjoyed being part of the Toastmasters meeting. Thank you.
Thank you, Adil, for being part of today's meeting, and I hope you'll come for many more. Thank you so much. Now, let me give the answer. Who won what? So, firstly, for best auxiliary role player, any guesses?
Of course, Priya. When she is there, no one else has any chance.
That is true. Toastmaster Priya, you won the best auxiliary role player for grammarian. Congratulations for inspiring us and for doing a wonderful job as grammarian. There's a lot to learn from you. Thank you. For table topics, any guesses? Best table topic speaker.
Can we just announce instead of guessing, please? That will save
Yeah,
time.
sure. Sure. We have first timer Vani Agarwal winning the best table topic speaker. Congratulations. You did a great job.
Thank you.
Thank you so much for taking part. Yeah.
Keeping
And
with
now,
ladies first. Ladies first, right?
yeah. Now for best lead role player, we have a tie break among all the players. Congratulations everyone for the combined effort. Applause, please. Yes. Now that this done, I would like to hand over it to Toastmaster Priya.
Thank you. Thank you, everybody, for this wonderful meeting. I know it's lunchtime and we are already having, time slipping away. It's a Sunday lunch. So please enjoy your lunch with your family without taking any more time. I would encourage you to please keep coming for every meeting of Toastmasters. Being in your own place, you can visit anywhere across the world through Toastmasters online forum. So it is we, Sattvic Toastmasters Club and Enunciators Toastmasters Club, signing off for today. Great learnings and great messages. And Toastmaster Noor Mohammed, you've been fabulous. We will connect. Thank you very much. Bye-bye, everyone. Please enjoy your Sunday for whatever is remaining. Bye.
Thanks, everyone. By this, we are officially adjourned the meeting. I will stop the recording.